if you really want to achieve a long-lasting and fully effective result, oftentimes surgery is the right choice, even though there are some disadvantages as far as risks or as far as scar that are involved in the procedures. Those disadvantages often weigh out, are well outweighed by the benefits that you get from the procedure, not the very least of the fact that it's a long-term solution to a problem.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Cory Goldberg, who completed his plastic surgery residency at the University of Toronto, which included the Surgeon Scientist program, earning him a Master of Applied Science in Biomedical Engineering with a thesis on stem cells. He subsequently completed a pediatric craniofacial fellowship at the University of Southern California and is dual board certified in plastic surgery in both Canada and the United States. His private plastic surgery practice is in Toronto, Canada, and he volunteers with Operation Smile, doing cleft lip and palate surgery around the world, including missions to Cambodia, Egypt, Honduras, and Bolivia. He also earned an executive MBA in international business from Cornell and Queen's Schools of Business and co-founded HealthSpan Digital in 2023. So Dr. Goldberg, welcome and glad to have you here.
Daniel, it's a pleasure. Thank you so much for taking the time to speak with me.
Yeah, so let's dive right into it. How did you first get interested in plastic surgery?
I guess I came by it naturally. My father was a surgeon, although not plastic. He was a vascular surgeon, and he practiced in Toronto, Canada. And so I really had an interest in surgery from the outset. But originally, I actually wanted to be an orthopedic surgeon. But when I got to med school and I actually experienced orthopedic surgery, I realized that it really wasn't for me. And plastic surgery, when I spent some time in the operating room, and I realized just the breadth that it covers, from head to toe and different tissue types. And I realized that there was a lot of artistry and elegance to the procedures that immediately ignited my passion. And I was an artist growing up. I did a lot of painting and sculpting and that kind of thing. So, coming to plastic surgery just seemed a very natural fit for me. And I, immediately took to that, and that kind of set the course of my career.
Mm-hmm. You brought up something very interesting, which I think a lot of other professionals in your space talk about, is that the painting, the artistry part of it. And I'm curious, I'm sure that when it comes to your approach to patient care, what would you say as far as what role does creativity play in it? Because I think a lot of people think about medicine, especially surgery, they're thinking that, there's this step-by-step proven process. It's step A to step B to step C and so on until you finish. But where do you think creativity plays a part in that, especially you having that more artistic background as well?
It's a really good question, and it varies so much by procedure and by surgery type. And, for example, orthopedic surgery, a joint replacement can, fundamentally be broken down into, 25 very specific steps, and each operation follows those same steps. And they're complex, and it requires a lot of skill to execute. But each procedure is pretty much the same. There's really not a lot of artistry to that. And then one of the things really that drew me into plastic surgery was that it does require a creative eye. You really do need to think about each procedure. And rather than following steps in plastic surgery, it's much more that we follow principles. And when we learn those principles, whether it's principles of tissue handling or the geometry and measurements of certain types of repairs or techniques, you then take that knowledge and then you apply it. But usually you have to apply it in creative ways. And when it comes especially to cosmetic surgery, you're applying the principles and techniques in creative ways. And then also you have to have an artistic eye to appreciate beauty and what a patient is looking for and what they perceive as beauty, and kind of wrap that up into how do you achieve it by applying these techniques and principles. And oftentimes it requires, problem solving things that are not standard or not common, or it requires modifying what you do. So really an artistic eye is very important in plastic surgery, especially in the cosmetic world.
Got it. Now, what would you say are the common procedures that you do with the patients that are coming into your practice? What are the most common ones?
Well, I have a craniofacial specialty. So, as a plastic surgeon, I tend to do a lot of facial procedures. So, I focus a lot on face rejuvenation, which includes, eyelid surgery, facelifts, neck lifts, those kinds of things. I also do a lot of things that involve more like reshaping or balancing type procedures, such as, chin jaw surgery or nose surgery. And those sorts of procedures are often more about restoring harmony to someone's facial aesthetics or balance rather than rejuvenation. So I do a lot of facial things, but I do a full range of plastic surgery procedures, including, breast restoration, breast augmentation, body contouring and tummy tucks and liposuction. So, I do full head to toe and, have a little bit of an emphasis on facial procedures in that.
Got it. And when it comes to the procedures, are there any new or emerging techniques or treatments or procedures that you're particularly excited about?
It's a great question. And, one of the things about plastic surgery and surgery in general, there's an expression, there's nothing new under the sun. Meaning, for the most part, when we establish techniques, they're established, based on fundamental strategies or well-recognized, types of procedures. And then there's an evolution as far as how they're done or modifications. And usually what that means is that there's, multiple different techniques. So, for example, for a facelift, there's, 100 or more different ways that you can do it. And everyone would say that the way they do it is the best. So in the end, it really comes down to oftentimes incorporating new things that you haven't necessarily trained on or seen, and incorporating that into what you do and evolving. And so I find over my lifetime, I've definitely changed how I do things. And the expression, that's why they call it practice, is because ultimately you're practicing and getting better at what you do and incorporating new things. So I guess in short, I don't know that there's one specific brand new that's never been done. There's certainly a lot of new techniques that involve sort of faster recovery times for patients. And decreasing downtime for them by reducing pain and inflammation. So I think the overall the biggest change in surgery I've seen over the past 10 or 20 years is the fact that we can get patients through relatively big procedures and give them a much easier recovery process. Much less pain, much less downtime, much less swelling. And then kind of get them on their way more quickly. If I could focus on one thing, and another very common expression, everything old is new again. There's a procedure that I do, which I can't say is a new one, but it's actually one that has a long track record, but it got kind of lost in the sort of annals of time in plastic surgery, and it's something called a phenol peel. And it's something I'm really, particularly passionate about because it's an amazing technique for restoring skin in patients who have, sun damage and lines. It's a technique actually that requires a fair bit of creativity and artistry. And the phenol croton oil peel is something that's been around for 50 years or so. But the evolution of each generation of surgeon that does that kind of a chemical peel, it's improved and changed. But it's something that only surgeons will do, some dermatologists will do, and it requires a trip to the operating room, but the results are spectacular. So it's a very intense procedure. I learned it about 14 years ago from a gentleman by the name of Richard Ben Simon, and he was kind of my mentor and how I learned to do this. But actually, there's not very many people doing it, and I didn't realize that until the past 6 months or so. So it's something that's kind of new, and it's funny because there's been a massive upsurge in people looking for this, but I think it's more because people are aware of this, and the past decade or so, there's been a bit of a lull that people didn't know it existed. So that's my kind of new, but it's old but new now.
Okay, interesting. And in your introduction, you did your thesis on stem cells, which I think is very fascinating. I want to get your thoughts on how you think stem cells is going to affect or influence plastic surgery, because I talked to a lot of medical practices, and I know that stem cells is really starting to get more into the non-invasive type of practice, medical spas, those types of non-invasive procedures. But I want to get your thoughts from a plastic surgeon perspective. Where do you think stem cells have their place when it comes specifically to plastic surgery?
That's a great question. Well, first off, let's pre-frame and just acknowledge that stem cells is a very broad term. I mean, there's a lot of different types of stem cells. So that's something for people to be aware of. It's not just a one item. There's many different types. A second really important point is that at this moment in time, neither the FDA nor Health Canada have approved the use of stem cells in any way other than applying things topically. You could put whatever you want on intact skin, But the idea of injecting it or putting it in a surgical site or anything internal, at this point in time, that is not approved in any way. So, people at this time who are getting stem cell treatments, they're leaving the country. They're going, offshore to places and getting things done. My thoughts about that, and then, how it relates to plastic surgery. I guess first off, using stem cells, without clinical evidence or really knowing what you're putting into people, I don't believe that that's very beneficial. And I think that there's a lot of let's say cowboy type of behavior going on where people are just, stem cell, give it to me, put it in my veins. But interestingly, stem cells are really actually very large. And if you inject someone intravenously, if you give them a dose, into their veins of the stem cells, in fact, within a couple of minutes, all of those stem cells, 98% or more of them, they're stuck in your lungs because they go through your heart and they end up getting picked up in the mesh of the lungs. And they're actually broken down, and the little pieces of the cells are taken up and do lots of good things for you, but in a very limited way. So people who think they're getting stem cell treatments and think they're getting some huge benefit, they're kind of fooling themselves. So it's important to have the context of all of that when you're thinking about how stem cells could be applied. In the sort of theme of plastic surgery and how stem cells could be applied, I think that the main ways that you can look at stem cells are as a source of tissue, as an anti-inflammatory, and as a growth factor. So as a source of tissue, there is the potential to take stem cells and grow them down specific pathways. So for example, you could take something called a mesenchymal stem cell, and the mesenchymal stem cell is one that gets, can change into the mesenchyme, which in an embryo is the type of tissue that would become muscle or bone or fat or the sort of structural types of tissues. So if you take one of these mesenchymal stem cells and you put it down the right path, you can grow fat. And you could potentially use that for grafting or putting into patients. You could grow bone and also do the same sort of thing. Now, there's been a lot of effort along those lines, and to this point, that hasn't really happened. And there's a lot of reasons for it. And part of it is because you're not allowed to. I mean, the FDA and Health Canada wouldn't allow it. Even if you could, there are surgical limitations to that as far as how to implant or transplant tissue. So the idea that you can just grow, tissue types or grow someone a new arm or a leg or something in the lab and then attach it, it's not here, and it's not coming anytime soon. I mean, our technology is not able to do that, and I'm not sure we'll get there, honestly. But that sort of use of stem cells is a concept, but it's not a reality. The bigger ways that we can apply stem cells ultimately are as anti-inflammatory, mediators and growth factors. So, very common, you're probably aware of PRP, so platelet-rich plasma. So platelet-rich plasma is a way of concentrating platelets from your blood, and platelets are a huge storehouse for growth factors and anti-inflammatory factors. So when you're injecting people with PRP, you're basically giving them a little dose of that anti-inflammatory, a little growth factor. There's like a little ignition, just a little bit of a push. Stem cells are like that, but they keep on producing. So stem cells are like major factories of all these good things. So the best use of stem cells that I see for the future would be, ways of using it to help reduce inflammation in places, and also as growth factors. And, applying growth factors and things that can stimulate new growth could be used in lots of places. I mean, that could be used on burns and reconstructive areas. It could be used on chronic wounds. In a cosmetic sense, it could certainly be used to thicken skin or improve skin quality, much in the same way that you can inject someone's face with PRP. If you could inject someone with functioning stem cells that were helpful and not harmful, they could absolutely release the good things and help stimulate growth and reduce inflammation. So, again, we're not at the point where that's a safe thing to do, and there's definitely some potential risks. So lots of research to do before we can get to that point. So, all that to say, in plastic surgery, because we're dealing with tissue and we're trying to reduce inflammation in the tissue and grow tissue and move tissue, stem cells have lots of potential benefits around helping with that. But where we are right now in using them is a very nascent early stage. And so, the future of how stem cells get applied in plastic surgery is still to be determined, and still quite a ways off.
Okay. Well, I think it's interesting, the science and the path has gone down. So I guess we'll see. But I appreciate your thoughts on it. Now I want to shift over to talking about your patients. I'd like to understand a little bit more about how you approach educating your patients on the procedures and the treatments that you offer. Particularly, I'm sure that you have a wide range of people coming to you for different reasons. I'm sure some are also going to be nervous about getting some type of procedure done. So how do you approach that educational part and making them feel comfortable with what they need and what they're looking for?
Yeah, for sure. It's I think the most important part of my role is as an educator. I have a lot of years of education and experience, and that lends itself to making good decisions. And I have lots of training as a technician and how to operate and do things, and that's got value and it's really important. But in the end, how I interface with patients is vital, and that role of education is so important. And so how I approach that, I guess the first thing and the most important thing as a teacher, I think it's, recognizing the person that you're teaching, what their foundational knowledge is and what their needs are. And once you establish that, you kind of know how to approach them, how to speak to them, and what you should be saying and what they need to hear. So, my approach to a patient, in general terms is, first off, establish their kind of background and what their medical history is and any issues that might come up in general for treating them. Then establish what the issues are and what's motivating them and what they want. And from that, then I can sort of come up with a treatment plan. With a treatment plan in hand, the next thing and the most important thing is sit and talk to them. This is what we've come up with as a plan. These are the potential outcomes. These are the potential risks and benefits. And that education really requires a good ear. I find a lot of patients have come to me over the years and they tell me, I went to see surgeon X and, he just didn't listen. And sometimes I have patients who say, I went and had surgery with surgeon Y and it didn't turn out the way I wanted it at all. And he didn't understand what I was asking for. And so that to me is a failure of education. You haven't properly listened to the person that you're talking to. So, it's easy to just sit down and spit out, these are risks, these are, benefits, and that's the end of it. But really it's an interactive discourse with the patient to sort of see what the right thing to do is, and to make sure that you're fulfilling their needs so that they really understand what you're talking about.
How about misconceptions? What are some common misconceptions that your patients come to you with?
Misconceptions. Hollywood and plastic surgery in the media, it'll give people a little bit of a skewed idea of what the surgery can accomplish, and also recovery. So I think that the misconceptions are related to people sort of thinking that you can just custom order what you want and walk in and walk out like you just pass through McDonald's, and place your order and walk out and you're done. In the end, this is something that has a healing process and a recovery time. And it's not always an immediate smooth one. Sometimes there's a period of time where things are still swollen and then it settles down. So it's not a linear recovery. So people's misconception that comes up from seeing Nip Tuck and various other Hollywood perspectives on plastic surgery, they kind of feel like they're going to walk in and walk out and be done. And to some extent, people have gravitated over the past decade or two towards those kinds of treatments. The non-surgical part of our industry has boomed. I mean, everybody wants the lunchtime lift or the lunchtime whatever, because they kind of want to just walk in and walk out and be done. And somewhere in there's another misconception, which is that you can achieve anything that you want, just ask for it, and it can be done non-surgically and immediately. And I'd say that's a huge misconception, because in the end, the non-surgical treatments can't supplant, you can't replace surgery. And so that definitely is an industry trend that I'm seeing now, which is that the non-surgical growth, which was very consistently going up and up year on year, it's really kind of tapered off. And I feel that's because the general public are recognizing you can chase some perception of beauty with these injections and lasers and things, but in the end, you're not quite going to get to what you're looking for. And if you really want to achieve a long-lasting and fully effective result, oftentimes surgery is the right choice, even though there are some disadvantages as far as risks or as far as scar that are involved in the procedures. Those disadvantages often are well outweighed by the benefits that you get from the procedure, not the very least of the fact that it's a long-term solution to a problem. So, I think that pendulum is swinging back more towards the surgery side of things, but, definite misconceptions that people have about recovery from procedures, and misconceptions around non-surgical things being able to just solve any problem that they come with.
Got it. And when it comes to the actual patient experience, how do you balance providing that relaxing experience for them while also ensuring their safety and well-being? Because I'm sure a lot of them come in, and I don't know if this is a common misconception, but they may be thinking, oh, this is going to be really painful or really scary, or so like, how do you help them relax but also maintain safety at the same time?
It's a good question, and that's a tough. I would say it's a tough line to walk, in that you have to sort of hold someone's hand and keep them calm and focus on them and their concerns and general anxiety level. But at the same time, in the back of your head, you got to be listening to everything and aware of everything that's going on. In an operating room setting, once someone goes to sleep, it's kind of the same. You need to maintain your complete level-headedness and calmness all the time. And the nursing staff and people you work with need to, see that. And at the same time, you need to carry out a procedure and be listening to the anesthetic machine in the background, and be listening to the nurses and what they're doing, making sure that they're on top of, dressings or supplies that you need. So, in the end, how many thousands of hours in operating rooms I've spent in my training, in my career, I don't know, but you develop the ability to just by rote and without really thinking about it, carry out those steps and be aware of everything going around you, while at the same time, you can manage yourself and your own emotions and keep yourself level and help the patient through that procedure as well. And of course, when you're doing something under a sedation or, purely local anesthesia, that's vital, because, the patient and their experience is certainly not going to be a pleasant one if you're anxious throughout. But the safety thing is it's innate. It's there. Everything that you do, from the amount of anesthetic that you use to the medication mixes, all of that. There are checklists, and it's that has to be inside. That has to just happen. And you get used to that, and that's just that's part of the job to make sure that you got all that going on in the background.
Now, I'm sure that you've had some, over your experience, some particularly challenging cases that have come across your door. Is there maybe one that really stands out that was just a really tough case, and how you were able to get them a successful outcome in the end, or just cases that really stand out in your mind?
Great question. I have lots of patients that really struck me as far as the benefit to them. I mentioned earlier the experiences that I've had where patient has had surgery with someone else and then come to me later and express concern about what was done. I had a patient not that long ago. It was a male, not quite 50, and a really, really lovely guy, a gentleman, and he came to me. He had a rhinoplasty done by another surgeon probably 10-15 years ago, and flat out, when he met me, he said, I never got what I wanted. It was actually really upsetting to me. It changed how I look, and I've never been the same since. And at the same time, he told me a story that he had a partner, a woman that he was married to, and he described this person as the love of his life, and she unfortunately had passed away not that long before I met this gentleman, and he came to me and he said, for 15 years I felt like it's not my face, and I've just lost the love of my life, and I need to do something about this. I need to feel like I'm restored physically and emotionally. And I got to admit that really hit me. That story really, really struck me. And a lot of surgeons don't like taking on secondary rhinoplasties because they're hard. And this one was not an easy one. And I operated on him. And I mean, in the end, he was happy, and he came back to me, and he gave me this card and a little gift with like a puzzle that had these nails to organize, and he had me open this gift up, and he said, Dr. Goldberg, you nailed it. And it was one of the funniest things patient has ever given me or said to me, and it really hit me. And because I kind of had this personal feeling for this guy, that just blew me away. So, it's sometimes surgeons will shy away from harder procedures or things that are not, an easy, obvious fix. And, in the end, sometimes it's the ones that are the more challenging ones that are a bit more subtle, that if you take the time to listen to somebody and what they're really looking for, that extra time to kind of get it and then think of how you can accomplish it, that extra moment of communication and problem solving as far as how you're going to do something, that can be worth everything. And I mean, I as far as I can see, I've changed this guy's life. He says, you gave me my face back. I feel like me again. So that really struck me. I really I feel good about that one.
I think you bring up a very interesting point, that when I ask people this question, like other people that I interview on this podcast, and very often it's just like the stories that really stay with them are the ones where they were really able to get like it was more for the emotional side of it. It wasn't just the aesthetics. It wasn't just, oh, make me look even more gorgeous than I am now. It's usually something where they feel that there's a deficiency, and it's more on the emotional level. And by helping them resolve the physical side, it's almost like they get a piece of their soul back. I think a lot of people don't view aesthetics like that. They view aesthetics as, oh, it's purely vanity, it's purely about looks. They don't know about the other side, where it's very much getting a piece of your emotional being back. So
yeah, it's a very, you make a very good point. And it's funny to think of it this way, but I'm kind of like a surgical psychiatrist, if you can call me that. That's what plastic surgery does. In the end, people often will come to me and say, what do I need? Personally, and family, friends, they'll come to me and ask me that. Even in my office, people will come in and say, well, what do you think I should have? And I say the same thing to everybody. I say to them, you're perfect the way you are. Don't do a thing. And for the most part, people are kind of taken aback by that. They're like, yeah, you're a smooth talker, doc. But, the reality is that people are perfect the way they are. If you just accept yourself and you're happy in your own skin, then good on you. I mean, that's a feeling of beauty. Good for you. And that's the right way to do it. But some people don't have that feeling. There's something that doesn't seem right. Whether, the patient I just described, his nose was off. Everything else looked perfectly fine. And just that one feature, that's what his eye went to. And I see lots of other patients, people who have had very small deficiencies, whether it's a mole or something that you wouldn't even notice. But at the same time, that little thing, that one thing, it's enough to make them shut-ins. Like, they don't want to go out, they don't date. All they can do is think about that one thing. And sometimes all that you have to do is address that one little problem, and man, you've changed somebody's life. So, it's not a question of how big is a deformity or how bad does somebody look, because in the end, everyone's beautiful, everyone looks good the way they are. But at the same time, you need to listen to somebody and what they see in the mirror and how it's affecting them, and then think about whether or not you can really make a difference. And honestly, sometimes people will point things out to me that I can't see, and if that's the case, that's not normal. There are people that I have to tell, look, what you see in the mirror, what you're looking at, I don't see that, and your perception of yourself is exaggerated. I mean, that's what body dysmorphic disorder is. That's when someone really doesn't see the reality in the mirror. For those patients, I really have to talk to them and convince them to really give another thought to how they look in the mirror. But more often than not, when someone comes to me, they're coming with a legitimate concern, and often it's something that really impacts them immensely. And that's it. It's a physical way of achieving an emotional outcome, and man, it can be powerful. And that's, to me, that's the passion. That's what really drives me and makes me feel good about what I do, is the fact that I can be part of that with someone and help them on their journey to feeling good about themselves and confidence and just facing the world feeling good about things.
Okay, well, thank you for sharing that, Dr. Goldberg. I think it's a great viewpoint. It's a great story. And I'm curious, where do you think the future of plastic surgery, of aesthetics in general, is going?
So, I think that where we're at right now in the aesthetic industry is at a bit of I'll call it a crossroads. I think that the past couple of decades, as these non-surgical treatments have become more and more popular and easier to obtain, and it's almost been commoditized. I mean, you can get Botox or neurotoxin or fillers at pretty much any corner. We've also gone down a slippery slope where the industry has caused more and more exaggerated outcomes and really changed what beauty is. Right now, big overdone things, big lips, big buttocks, all those things became popular, and that really wasn't the case 20 years ago. So, in as much as, the past few thousand years, we've definitely seen changes in what beauty looks like. A few hundred years ago, for a woman to be beautiful, they needed to be heavy. And that's because, they could eat and actually had food. And otherwise, people were emaciated and thin and malnourished. So, beauty came from having an adequate amount or a plethora of food. That's not the same now. So, beauty evolves, but the past 20 years has seen the beauty industry distort beauty. And so I think the future of the beauty industry is, at this crossroads, we're going to go down a path of, I think, normalization. I think we're going to get back to more natural appearances. I think we're going to be looking for results that are consistent and balancing. I think that there's going to be more surgical things done to achieve that, and surgery done in ways that are, low risk and easy recovery, and less kind of overdone, exaggerated appearances. And I think that that's going to be a big changing factor. And along those lines, there's going to be more and more health within the aesthetic industry. Somewhere we've kind of forgotten the premise that, true beauty is about being healthy. Good skin and beautiful skin comes from having healthy skin. Having a beautiful figure comes from being healthy and fit. And, certainly surgery can add to that, and it can, get people over things that they can't do without surgery. For example, there are lots of things that happen to, mothers after having a couple of babies, and the mommy makeover, that achieves things that you can't do on your own. And so that's where surgery and health and lifestyle blend together. And I think that the plastic surgery industry has really left behind the health part of things. And I think that'll be a big change. I think the next 5 years or so is going to see plastic surgery and health and longevity blend into one, while people will come in asking about wrinkles and skin and a body contouring procedure. Those patients are going to be introduced into a world where they're going to have access to tools that can actually help them be healthier and achieve part of their results on their own. And I think that kind of integrated care where we're going to bring beauty through health is going to become more and more common. And so I think that's going to be a big change coming to our industry.
Got it. Okay, well, Dr. Goldberg, I have one last question for you. But before I ask it, I want to point people to your website at www.corygoldbergmd.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which doctor to choose?
So I think the most important thing, I'm going to assume that you've done some research and going online and checking on somebody's credentials, and ideally they'll have some social media presence so that you can have a little bit of an idea of who they are as a person. Once you've kind of gone through that vetting and kind of intake, once you go and see the surgeon, my biggest piece of advice is not to look at the papers on the wall or how pretty their office is. Those things can be made up. Anyone can hang papers or make a nice office. The most important thing is your interaction with the person. If you're comfortable with them, if they communicate with you in a way that you can understand them, if they inspire you with confidence and a feeling like you like this person, that's a good indicator. Then you can feel comfortable with that surgeon, because in the end it's like a relationship. It's a partnership. You as a patient, you and your surgeon are entering into a relationship where you're collaborating basically on a piece of art. You are basically turning yourself into a medium for a surgeon to work on. And if you're going to let yourself, have that relationship with someone, you should darn well like them and be comfortable with them in that role. So, I think that, making sure that your surgeon does all the things that we've just talked about, listen to you carefully and understand what you're trying to get to, and be able to share information with you in a way that you really understand, so that, push comes to shove, if you have surgery, goodness forbid that there should be a complication. But if it happens, you want to be able to deal with someone that you like, that can walk you through, that you're comfortable with, to get you over that. So that personal relationship, I really think is kind of the key determinant to helping pick a surgeon.
Got it. Well, there you have it. Dr. Goldberg sharing his expertise. Now, Doctor, where can people contact you in your practice?
I'm on Instagram at Dr. Cory Goldberg MD. So you can have a look through my stuff there. I put personal things so you kind of have an idea who I am. My website, corygoldbergmd.com, is also a good way of reaching out to me. So, certainly happy to hear from people if you have questions. And, if you'd like to come in and see me for anything, if you're in the Toronto area, I'd certainly be happy to see you.
Great. Well, thanks for being on the show and sharing your message.
It's my pleasure. Thank you so much for having me, Daniel.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.